Then comes what comes afterwards? Mixas chayli, right? Mixas chayli. Then comes sakana. Mixas chayli means someone who is not feeling so well, has a cold. Virus is functioning. Chayli sakana means what? It's not functioning. Then goes after that goes Sar Godel. Yep. Sar Godel is in a lot of pain. And then goes Sakanas Aver. Sakanas Aver. Danger of a limb. Sakanas Aver. And then goes Chodesh Yesh Beisakana. Okay, so okay, are all these categories clear? So Mechesh V'Alma, just the regular ache and pain, you can't do anything for it. You can't do any medicine, you can't do anything that's prohibited. You can do there's things you can do if it's not the category of medicine, you can do it. But you can't do something that's prohibited, right? Miktas Chayla means you're not feeling well. So you're not feeling well, but you're functioning, you're walking, you're going places, but you have a cold, you're not feeling so well. Miktas Chayla, the only thing you can do is you can ask a non-Jew to do something that's rabbinically prohibited for you. So we're going to teach you a new term they call shvus. Something that's a rabbinical prohibition on Shabbos. This is in general, nothing to do with this topic. It's still Shabbos in general, that anything that's rabbinically prohibited is called a shvus. From the word Shabbos, Shabbos means resting. Shvus is a rabbinic prohibition, is called shvus. The term is shvus. Is everything clear? I see some of you are still writing down. Yeah, you got it? Yeah. Shvus. Anything that's a rabbinic prohibition is called shvus. That means telling a non-Jew to do something that's prohibited according to the Torah and asking him to do it on Shabbos, that's a rabbinic prohibition. You're not allowed to tell a non-Jew to do something that's prohibited on Shabbos. If you're telling him to do something that's prohibited biblically, then that's a shvus. If you're telling a non-Jew to do something that's prohibited rabbinically, then it's called shvus to shvus. So before we get to let me just back up to shvus first, okay? Shvus. So shvus means if you do something that's prohibited rabbinically, or if you tell a non-Jew to do something that's prohibited biblically. When you tell a non-Jew to do something that's prohibited according to the Torah biblically, then that's a rabbinic prohibition. Now you can be doing, if you do a rabbinic prohibition yourself, that's also shvus. So it's a different type of shvus. Here is you doing the rabbinic prohibition, or you telling a non-Jew to do a biblical prohibition. That's also a rabbinic prohibition to tell a non-Jew to do something that's prohibited biblically. Get it? Mm-hmm. Right? Makes sense? Yeah, it's something called shvus to shvus. What's shvus to shvus? Who can guess what's shvus to shvus? Who can guess? I mean, I don't mean guess. I mean, figure it out from what I said. That's what I did. But guessing mean. If you tell a non-Jew to do something that's prohibited rabbinically, it means if you would do it, it would be a shvus. But you tell the non-Jew to do that, so that's shvus to shvus. Now it's two steps removed. Whatever you want to call it, shvus to shvus, rabbinic of rabbinic, because you are telling a non-Jew to do a rabbinic prohibition. If you would do it yourself, it would be a shvus. But you're telling the non-Jew to do it, so now it's shvus to shvus. It's less severe than you do it yourself. Another example of shvus to shvus would be if you are doing something, if you're telling a non-Jew, let's say you would do something with a shinui. Shinui, you have the term shinui. Shinui means an unusual way. Shinui, it's about shinui. Shinui means doing it in a different way. So if you are doing a biblical transgression, and you're doing it in an unusual way. Let's say you're carrying outside, but not in a regular way. Instead of carrying in the pocket, you take something, you stick it into your shoe, like this, and you walk, you stick it inside your shoe, and you carry it. That's not a regular way of carrying. So even though it's prohibited biblically to carry outside, but if you carry it in an unusual way, then it's called a shvus. Now do it still not allowed, but it's called a shvus.
So what's the difference between shvus?
There's different types of shvus.
Okay.
Shvus means rabbinic prohibition.
Right.
If you're doing a biblical prohibition in an unusual way, like you're putting something inside your shoe, there are cases which discuss a person needs medicine and you're not allowed to carry it on Shabbos. So in some situations, we're going to talk about it, you could carry it in an unusual way. So you take the medicine, you stick it inside your shoe, let's say, to carry it to someone. So assuming that carrying is a biblical transgression, the discussion itself, but assuming that it is, so now when you carry it in an unusual way, it's called a shvus.
So shinui is a type of shvus?
Shinui turns it into a shvus, meaning according to anything that's prohibited biblically is a shvus. Now, according to the Torah, it's only prohibited to carry in a regular way. The Torah doesn't speak about carrying an unusual way. According to the Torah, carrying an unusual way is not prohibited. I would say it's prohibited. So carrying an unusual way is shvus. There's different types. Shvus is anything that's rabbinically prohibited in regards to Shabbos. Doesn't apply to any rabbinic prohibition across the board, but anything that's in regards to keeping Shabbos is if it's rabbinic, then it's called a shvus. Having said that, there's another example of shvus to shvus, which is if you're telling a non-Jew to do something that's prohibited biblically and you tell him to carry it in an unusual way, then it will become shvus to shvus. Telling the guy to carry in an unusual way, assuming carrying is prohibited biblically, carrying an unusual way is a shvus. Now you're telling the guy to do it in an unusual way, then it becomes shvus to shvus. So you're getting a basic idea. If you don't get it exactly, worry about it, just getting the basic idea, and you can always clarify it, because we're going to discuss what you can do on Shabbos, in what situation you could do shvus to shvus, to a guy, to a Jew. It's very detailed. Okay. So Miktas Chayli. Miktas Chayli, what are you allowed to do on Shabbos? We didn't discuss this at all, did we? What could you do for Miktas Chayli on Shabbos? Anyone, did we mention it? I want to see if anyone remembers. I don't know exactly what I didn't discuss anything. No? Okay. Can you take medicine, Miktas Chayli? Someone is in that category? No, you can't take medicine. Miktas Chayli can't take medicine. What you're allowed to do is shvus to shvus. Shvus to shvus. Why did I switch? Okay, took another one in. Shvus to shvus is allowed for Miktas Chayli. Shvus to shvus. Any shvus to shvus. Yeah, I mix something up here 1 second. The order is a little eraser here. The order is not exact.
Just under your paper.
Oh, thank you. Notice this? Sorry, go now. Miktas Chayli, then goes Tsar Gadol. Then goes Chayli Shleim Sakani. Okay, so Miktas Chayli, you're allowed to do shvus to shvus. Any shvus to shvus. Tsar Gadol, someone is in tremendous pain, discussed not a pain that's, in other words, a danger, it's called tzara, we're not talking about that type of pain. You know what it is, no danger, but in a lot of pain, not excruciating, that he can't function, he's mamish like, it's ridiculous, it can be, that's all about intense pain, it's mamish like, very, very uncomfortable, very painful. So then we also allow Shabbos to Shabbos, and over here, there's more flexibility. I'm not going to go into within Shabbos to Shabbos. There's different types of Shabbos to Shabbos, but I'll leave it at that so it doesn't get too complicated now. So Tsar goes also allow Shabbos to Shabbos, but there is a difference between them, which we'll discuss. Just want to get the basics on here. Now, Chayil Hashem Sakana, that we allow a Shabbos. We allow a Shabbos, not every Shabbos, only a Shabbos through a guy. Shabbos, but it has to be a Shabbos through a guy. It can't be a Shabbos of a Yid. What does it mean, a Shabbos of a Yid? A Jew cannot do a rabbinic prohibition. In the case of Chayil Hashem Sakana, the exception is that he can take medication, and then there can be exceptions according to some opinions. If there's no non-Jew available, then you can have a Jew do it. An example would be, I think I mentioned this, spoke about, did we discuss this here? I teach you other place else to say about injection on Shabbos, giving an injection, yeah? Giving an injection on Shabbos is a rabbinic prohibition. So for a Jew to give an injection to someone who's in this status is an issue. But if there's no non-Jew around, in other words, ideally if someone needs an injection for something, someone is in the status of Chayil Hashem Sakana, not life is not in danger, but this is very sick, they need an injection, whatever it is. To start with, a non-Jew. If a non-Jew is absolutely not available, then there is a leniency that in other words, our opinions that say you could use a Jew, and it's reliable. The idea is that just like the logic is, because we're allowed to take medication, because if a person needs to take oral medication, you can't take it through a non-Jew, right? Ask the non-Jew, can you take the medication for me? Make any sense, right? So he has to take it himself. That's why it's allowed. The logic is the same thing over here. There's no non-Jew around, so you can have a Jew do it. But just to get the law clear, to start with, in other words, generally speaking, the rule is we allow rabbinic prohibition, but a rabbinic prohibition when you're telling the non-Jew to do, let's say, a biblical prohibition, which is a rabbinic prohibition. But for Jew to do a rabbinic prohibition is far worse because the Jew himself is involved. So now Moshe says, no, a Jew can't do it, but if there's no non-Jew available, there is many opinions that will be lenient. What is it?
No. The different one, the third one, is that it goes down.
A shlush to shlush makes it easier, correct?
Yeah, and by yourself.
Yes, and what
Like,
type?
no with her. Nobody wanna help you, but you need to.
What you want to give an example or you want to talk in general? How do you want to
No, like,
shlush to shlush?
yeah,
Like what?
no, I mean like,
Telling
you
you
do
know
the rabbinical prohibition, but by yourself. Right?
the person giving the injection himself, that's it.
Yeah, for example,
That's shlush. That's a
that's
Jew.
good.
That's shlush, but there's different types of shlush. There's shlush through a Jew, shlush through a goy. In other words, when a Jew gives the injection, that's a shlush through a Jew.
Yeah,
It's a Jew doing it. That's not. If you're telling a guy to do a biblical prohibition, let's say carry, now ends up being a rabbinic prohibition, right? That's also a shlush. But a shlush that the guy is involved with is lighter than a shlush where the Jew is involved because the Jew is doing something. Yeah, even though they're both rabbinic, but for the Jew to be involved is more restricted to, right?
Yeah, so who's this Bruce for?
What is shvus the shvus? Let's say if you're telling the non-Jew to give the injection. Give me an injection is a rabbinic prohibition. Telling the non-Jew to give the injection is shvus the shvus.
Okay.
So shvus the shvus is not, so shvus the shvus is not, no problem in this situation. It's even okay for this, actually. So what, if it's an injection through a guy, that's a shvus the shvus, then it's going to be allowed not only in this case, but also in this case,
Yeah.
Even someone's not feeling so well, an injection is going to help him. Being that it's a rabbinic prohibition and it's through a guy, you're allowed to do it. Or topical ointment, medication that's not oral, medication that's topical that you can smear on the body. So that's something that a non-Jew could do for you. I'm saying theoretically, I'm saying practically. I'm saying so if even in the case of niktsas chayli, someone who's just not feeling so well, not in bed, but you can have a non-Jew put cream on him if that's going to help him. No problem with that, because that's shvus to shvus. Any questions? So konas eved, the konas eved means danger of a limb. Danger of a limb, Hashem allowed any shvus. You can write it are you being non-Jew, which means when you say a shvus to a non-Jew, you mean that you're telling the non-Jew to do even a biblical prohibition. It ends up being a rabbinic prohibition, and that's okay in the case of a chil Hashem esakana. A chil Hashem esakana, you're allowed to tell a non-Jew if the person needs to eat, no food, you cook for him, even if it's special market, you can eat it. Let's say if that's necessary. It's not usually practical these days. It's Baruch Hashem, there's enough food, and it's not usually the case. But if need be, the person needs food. There's no food, it's not available. He needs to eat. Then is it this status? You can have a non-Jew cook for him, and even though the food will become bishalakum, if it could be avoided, of course it should be avoided, but if he needs that food, it's allowed. Yeah. Sakanas event, we allow any shvus. Shvus, even on the Yisrael, even through a Jew, you're allowed. Meaning the Jew himself could do a rabbinic prohibition if a person's limb is in danger. What does it mean a person's limb is in danger? Different examples for limb in danger. Let me find it now. Limb can mean pretty much any limb that's going to be, there's a danger involved that if you don't take care of it, either that limb will stop functioning or it'll be weakened to the extent, or it'll be weakened permanently. That's considered danger of a limb, which means you can't desecrate Shabbos for danger of a limb. However, there are many situations where when a limb is in danger, it could endanger the life too. So, even though halachically danger of a limb, you can't necessarily desecrate Shabbos, but practically many times there's danger of a limb, you could desecrate Shabbos. Because, for example, someone injured their elbow. Someone injured the elbow, that could be dangerous. Someone injured their thigh, it's dangerous. Because these are very sensitive parts. There are certain parts, a person injures them. So if let's say someone they hurt their foot, they think they fractured their foot, right? You can't desecrate Shabbos. You can't call it Salah for that. They should desecrate Shabbos to take it to the hospital because you fractured your foot and you need a cast, you need a splint, whatever you need a ace band-aid. You can't do that. If it's more serious, there's more, like I said, the elbow, the thigh, or if sometimes it could be a very serious break where it's mamish, like, you'll know yourself when, use common sense. But I'm talking about a regular fracture. Person fell, hit his foot, and he's walking, he needs to take x-rays, he needs to have a cast, and there can be cases where it could wait till after Shabbos. Theoretically, I'm not giving you the practical directional here, you have to use your intuition, not EMT. But generally, I'm giving the basic guidelines that, let's say it happens a few hours, Shabbos is going to be over soon. So after Shabbos, you go to the emergency room, you'll get it, put on a cast or whatever. You could, but not always could you wait so long. If you don't get treatment right away, a certain fractures, it could affect the healing of the foot permanently for life. So, in that case, even though it's not, again, in other words, within Sakonas Aver, let me clarify. I added another detail. Within Sakonas Aver, there could be situations where it's not danger of a limb at all because you can wait till after Shabbos. But we're not discussing it. But it's saying you need to take care of it. Sakonas Aver. You're allowed to do a rabbinic prohibition. You need to get treatment. Okay, so you could call it going. You call Uber to take you to the hospital to get treatment. Because you could do any rabbinic prohibition. Telling a non-Jew to drive for you using a phone is a rabbinic prohibition. It's not biblical, so no problem. You can do it yourself. But a Jew can't desecrate Shabbos because you need treatment because someone broke their foot. Again, unless there's more complications to it, sometimes it could be an older person who has different medical issues. That's, could be a different situation. We're talking about if there's no concern, there's no major health issue over here, that's what should be done. The eardrum, different parts of the body that could cause a loss of use of a limb if you don't take care of it. The eye, the ear, then for sure you could do a rabbinic prohibition. But again, when we talk about the ear and the eye, there are opinions that say you can even do a biblical prohibition because if it's not taken care of properly, it could affect other parts of the body. So there is discussion on this. It's not so simple. Okay. Let's discuss now. So we'll focus now on any questions. Let's talk about a little bit about Cheshvan. Something interesting about this. That Cheshvan, you're allowed to desecrate Shabbos. A person's life is in danger, and the discussion is about what if you could have a non-Jew do it for you instead of having a Jew desecrate Shabbos. You could have a non-Jew desecrate Shabbos, and a non-Jew do the work for you, drive you. Doesn't have to be specifically a Jew. And theoretically, there can be situations where you just tell the non-Jew to do it. Theoretically, that solar can have a system where, why do they have to drive that solar van? They can have a non-Jew that's hired. They're hiring. The Shabbos, he's hired. Like you have crowd nights, you have Shabbos, you have the Shemim car driving around. They hire a non-Jew to drive around. The question is, why cannot someone hire them that when they need it, they're available, they're in that solar van, and they when you drive a van, you're doing biblical transgressions constantly. Pressing the gas, there's fire going on, then you brake, you put it out the fire, you press the gas again. I know you're doing malachas one after the other when you're driving. So the question is, why can't they hire non-Jews to be available to drive at least at some of them, maybe not each person's cars, when you can have such a system? And the explanation is that we specifically don't want it to be done through non-Jews. We want it to be done through Jews. Anyone knows why? So one reason can be that if there's concern that the non-Jew is not going to be so, they're not rushing anywhere. But let's say he's good, he cares, he's gonna be as fast as you will be. Still, we prefer using Jews. Why? What can happen if a person sees that, oh, it's Shabbos, it's the Torah, who's driving the guy who's driving the Shabbos is just serious stuff. That's what creating Shabbos, and you take it seriously. Even if someone's life is in danger, you try to find the guy. Try to find the guy. Someone's life is in danger, you're going to try to find the guy. To koach nefesh, saving someone's life. The result of having such a system and there can be situations where it could work very well. Certain things that can work very well. You have a non-Jew with you, tell him do this, and he's fast. And it could work for certain things. It could minimize theoretically transgressions. But Chacham are concerned the result of such a system could lead to people walking away with the wrong impression that Shabbos is very serious, and when someone's life is in danger, we try to get non-Jews to do it. Imagine someone who's thinking that way, he's trying, someone's life in danger, he's trying to get, he's seeing maybe the non-Jews available, but I'm going to talk about seconds over here. But that's why the halacha is that we specifically use Jews to do everything from beginning to end. However, there is a discussion about, for example, when you get to the hospital, and once he's there already, now you have to park. It's really not relevant to anyone here, but it's just interesting just discussing it. When they come to the hospital, and once they brought the patient in, now they want to get the car, they want to park the car. It's in the road. There are some that say it's just an option to do it. I didn't go into such depth because it's not relevant to me. I'm working at Solar, but so it's something that's they could inquire if that's, I don't know what the meaning is, they do, they're not, but there is a discussion about that for that, they should, ask someone to park the car for them, because they're there already. What's a big deal? They're there already. The patient is in, now they have those minutes to ask someone to put the cars in the way. And then the question is also, after they bring the patient to the hospital, now they're done. Now, what are they doing now? They're driving back. Why are they driving back? Here, let's see one's life. Why are you driving back? Stay there. Stay all Shabbos to the hospital. I'm going to explain. One second. I'm explaining. I'm asking, why they drive? They do drive back. Why? Why are they driving back? Stay there. You don't have to save anyone's life. So one explanation is they might be needed when they're going back to. But that's not the whole thing, because in Crown you have hundreds of its own members. It's not the issue. The reason why they're allowed to drive back is because if we don't allow them to drive back, let's say the rough is, you don't drive back. Okay, so you don't drive back. Okay, so they won't drive back. Now, you want them to be available. Instead of having, let's say, just throwing a number, instead of having 40 members of its own available, you might have 30 or 25, because 10 of them are, 15 of them are like, I get to the house and I'm stuck to the whole job. There's 25 members, it's good enough. There's people who are willing to go, and they're okay staying in the hospital for Shabbos, so what have to make themselves available for? So what is this going to cause? That people won't be so available. When it comes to pikuach nefesh, saving a life, you look at every little detail. It's just going to cause that they're not going to want to be available. Not in a bad way. There are other people available, but now you're minimizing the amount of availability. It's not good. We don't want that. So we allow them to come back. So they should be willing to be available. Another example is on Shabbos, they go to shul and they carry their radios. Why? Why are they carrying the radios? They're going to say, what do you want to carry radios? Say they need to be available, right? No. Why are you going to shul? Stay home. Okay. So you want them to be available, they should stay home all day? Then they won't be available. It's the same logic. If you want them to be available, because we want them to be available, we allow things, we're not going to put restrictions that's going to cause them not to be available. They'll say, okay, how many people do we really need? 30, I'm just throwing a number. I don't know, my numbers may be totally off. Say you have 30 people who are available, good enough. I don't have to, be stuck in my house all Shabbos. I can't go to shul. I can't go to Fabring. I can't do this. I don't want. We don't want to constrict them to a point where they won't be available. That's the logic why they're allowed to walk with radios to shul. I assume it's probably that those that are more careful and they'll stay home. I'm sure there are those like that, but it's accepted because of that reason. So we should be available. Now there's a discussion about when someone's life is, when someone is in the status of Chileshesh Misakana, sometimes there's certain things that are done that are not necessarily just pikuach nefesh, not necessarily crucial to save the person's life. But if a person has he has this condition, whatever the condition is called, he has a certain condition, and he happens to be in the status of Chileshesh Misakana, his life is in danger. But for that condition, the protocol is they do A, B, C, D. That's what they do. But let's say C is not really crucial. It's not life, it's not putting his life in danger if you don't do that. Could you do that procedure? Could you allowed to desecrate Shabbos to do that procedure because his status is Chileshesh B'Sakana. And usually for this status, this is what they do. Now, he's in that status, you're allowed to desecrate Shabbos to save his life, to do what's necessary. The protocol is you do A, B, C, D. Those are the things you do. But one of those things are not so crucial. If you don't do it, his life won't be in danger, but that's part of the protocol. So are you allowed to do that? So here there's a machlekes, if you're allowed to do it or not. The halach is you could, but the Alter Rebbe says best to do it through a Vayt or a non-Jew. And but then the Alter Rebbe says, it comes out according to the Alter Rebbe, being that you don't want to have a non-Jew involved because people might think that you can't desecrate Shabbos just to be a non-Jew. So it comes out from the Alter Rebbe that it's better not to do any of those procedures for a person whose life is in danger through a non-Jew. Because then it could give the impression that the Alter Rebbe says, halachically you could do it through a Jew, but Alter Rebbe says someone who's more careful, a God-fearing person, should refrain from doing that procedure, the desecrate Shabbos, being that procedure is not necessary. Okay, maybe other classes I'll try to come with examples, and it's just, but are you getting the basic outline? Everyone is following what we're discussing? Yeah? And sometimes you need to lie if it's something that's not directly let's say you need to lie on from the light on, the light off, and the person is in that status. So obviously over there's a non-Jew available, you tell them to do it because it's not directly relevant to the procedure itself. So it's not like the Jew should be doing everything, even halachically. It's all about in terms of the procedure, in terms of the medicinal part. We're saying that halachically, because he's in that status and his life is in danger, and he might have desecrated Shabbos to save his life. So according to the letter of the law, halachically, you could do even the procedure, that procedure, he'll live without it. But doing other things for him, like putting on the light, putting off the light in the hospital, is a non-Jew available, you call them in and you have to put it on. That's not in the procedure, that's not part of the medicine itself, and we don't want anybody to be involved because it's a life and death issue, so we do it ourselves. Or if we said, if that procedure is not so crucial, it's best to avoid it. Any questions? Okay, so we'll go into more details. Within medicine itself. So, other examples Did we discuss about using ice in Shabbos? We discussed that crushing ice is using ice is not medicinal. That's why it's brought down. You're allowed to break ice if you need to break it. Because the intention is not to make it dissolve into water. If you need to crush it a little bit, it's okay. As long as the intention is not to crush it to the point to dissolve it, to make water, to break it a little bit is okay. But using heating pads is in the status of medicine. So whatever we discussed there about using medicine does apply to the heating pad. But for the ice, it's accepted that it's not in the category of medicine. It's just because the ice is just to stop it from swelling. And the reason why we prohibit using medicine is because of a concern it might come to growing herbs. So it's only by those items that there is medicine available for that.
But if you're using the heating pad, there's no herbs or anything, not medicine.
I hear you. It's a good question, but this is why it's a good question, but that's how it's brought down. I'm also trying to understand it, but they write that this is how it's brought down, that the heating pads is seemingly the heating pads is doing something to the body. Whereas the ice is just not allowing it to swell, to stop the swelling. And back then there was no herbs to stop swelling, to stop it from swelling. They would use like a certain item to press it down to stop the swelling. That's what it seems. So there was no decree on something to stop swelling on ice. And the question is asked, but these days they do have things that could stop swelling. But that's how the Achreinim, things get complicated. But that's how it's brought down. It's accepted that ice is okay. In general, we said that when it comes to medicine, remember we mentioned that medicine we could be lenient when there's a doubt. Not every single doubt. But we mentioned, I believe we mentioned this here, I think we did. But if you're in doubt, if you're in the status of Cheshvan Sakana, where you're allowed to take medicine, or perhaps you're in the status of sorry, go now, you're not allowed to take medicine. So being that you're not sure, it could be your in other words, in such pain. If you're in such pain that you're not functional, you feel like you want to be in bed, you're allowed to take medicine. But there's in between, where you're really not feeling well, you're in a lot of pain, very uncomfortable. If I'm going to ask you, see if you like you feel like you just want to be in bed, your body's so weak, it's in between. You're not sure, right? There's always like in between situations. So it's brought down because medicine these days is a whole discussion. It's possible that these days the prohibition of medicine doesn't exist. I'm not saying on a practical level to be lenient when it comes to medicine in Shabbos. But there is a discussion. There's some that say it could be these days medicine, the prohibition doesn't apply because no one grinds herbs these days for medicine. So it's not clear. It could be that medicine doesn't exist, the prohibition doesn't exist, and we still have to be strict. But in a case where there's a doubt, if you're in that status that you're allowed to take or you're not allowed to take, it's brought down, you could be lenient. So if this concern that maybe you're in that status of Cheshvan Sakana, where your whole body's very weak and you're not feeling well, if you want to be in bed, you're not functioning, then if this concern that could be in that status, then you can be lenient with medicine. I'm saying in general there is leniencies with medication. So therefore, we hear with the ice, the ice is brought down that is okay, and the heating pads is considered medicine. But again, even with heating pads, there are situations we could do medicine, and you can tell an non-Jew to put on heating pads because it's external. So for a buddy to put it on, for sure, there's no problem. But a Jew to put on is an issue. There is an interesting situation. How you're allowed? Did we speak about putting oil or cream on chapped skin?
Yeah.
We discussed it. We said you should be putting every day, right? Yeah. We said if you put every day, rain or shine, then you have no problem. Otherwise, you cannot do it if it's chapped. If it's itchy, then it's brought down, you could. If the skin is itchy, yeah, it's not Shabbos, it itches you, so you put it on cream. Then you're allowed to do it on Shabbos, because it's not, you're not healing anything. If it's chapped, then you can't. In other words, if you're not healing anything, if there's no medical issue, there's no issue. Remember we mentioned about the Tums? If you're expecting to get an upset stomach, you could take the medicine in advance because now it's not medicinal. You're okay, you're healthy. You're taking it in order to avoid the issue. So the same thing is also, so the same thing is also with, in other words, Tylenol in other words, not to get a headache. So you take a Tylenol in advance. And also, another interesting example is, it's a little different twist, and that is that you could put medicine, you could put ointment on the part of the body that is not, let's say oil. If you have an oil that could run down, if it's viscous, it's very loose, then if you pour it, you put it, let's say, on your hand, it's gonna come running down. So let's say one part of your hand is itchy, chapped, right? Itchy is not a problem. If it's chapped, so you could put it on the part that's not chapped, and then you make it run down. So you put it on the part that's not medicinal, and now it's making it to run down on the other part, then it's also okay, because as being a medicine is rabbinic, they will lenient in certain situations when you're not doing it exactly as in the regular way. You guys say?
I think you said that it's not like healing, so like it's like a poison ivy rash, and we have like
Poison ivy, then that's medicinal.
Right.
But again, poison ivy, question is what's the status? How important is it? If it's an issue of infection, any concern of infection, you could take medicine because that's dangerous infection, right? So medicine is when there's no concern of infection. Poison ivy, I don't know if it's an issue of infection, but hopefully we'll try to discuss more examples. I'm still looking through and share more information. It's a show on Wednesday. Yeah.
So if you put on cream every day for eczema, then you can
Right. So in general, there's a leniency that if you're doing medicine every day, you can do it on Shabbos also. That leniency is it's accepted. It's a leniency that's accepted. It's not. Some will be strict, but if you feel it's important for you and you do it every day, you can do it on Shabbos too. But you have to be careful with the malacha of smoothing, not to smooth out.
You would like that.
Either you dab, or you know what's brought down. It's also brought down if you put it on the material, whatever the gauze, and then you put it like that, it's okay. Even though you're pressing it down, it's brought down. It's okay because you're not. I guess it's not directly. You're not actually smooth, spreading out a little bit. So it's brought down, and you can put on the gauze pad and then press it down. And you can't take the gauze pad and make a whole big thing. But it says you can put on the gauze pad. You can't smear again. Gauze pad also, you can't start smoothing it out, but you could put on the gauze pad a few places. You can spread it out if you're smart, right? And then you push it down on your hand, even though it's going to spread out, push down out, it's brought down that it's okay.
What is it? Gauze.
Whatever you use, gauze, the Band-Aid, the cloth, whatever you use. So because it's not directly, it's you're pushing it down. I guess you're not actually smoothing it out in the same regular way, so it's okay.
Mm-hmm.
That's what it's brought down, and I still want to look into the exact reason, but that's what's brought down. Okay, so we'll continue to show on Wednesday.